today's session, we're going to be talking about some Medicare services for preventative care that is covered. And it is open enrollment season, so a lot is at stake. We definitely need to get as many services as possible covered through our healthcare programs. And this is a great time for us to learn more and be educated and even educate others as well. So with that said, I want to introduce today's speaker. She is under the weather. Please remember Catherine in your prayers. Her camera will be off, but I will still go ahead and introduce her. Catherine Nicklen is the Community Education Coordinator at the Center for Healthcare Rights, also known as HICAP for LA County. She coordinates community education programs for Medicare beneficiaries and the health and social work professionals who serve them. Catherine is also a state-registered HICAP counselor and helps answer questions about Medicare over the phone. She has been at the Center for Healthcare Rights since 2014, but is always learning something new about Medicare and never ceases to be amazed by the complexity of the healthcare system. All right, welcome, Catherine. If you have a lot of background noise, I recommend you please mute yourself. I would really appreciate it.
Yeah, there is a lot of background noise. Everybody should mute.
Okay, I'm muting some of you. And Catherine, please take it away.
Thank you. Good morning, everybody. It's very nice to be here with you again. I think this is the fourth presentation in a series that we've been doing with you. So I'm very excited for your continued participation. Today's presentation is all about Medicare coverage of preventive services. And we're going to talk a little bit about Medicare coverage of vaccines as well. So just give me one moment while I share my screen with you. I do have a PowerPoint that I'd like to share with you. All right. Okay, so before I get started, let me tell you a little bit more about the Center for Healthcare Rights. For those of you who have not joined us for a presentation in the past, welcome. For those of you who are returning, welcome back. But anyway, just so that we're all on the same page, I want to say that Center for Healthcare Rights is a nonprofit advocacy organization. We provide free education and help with Medicare and other related health insurance. So for example, a lot of people who have Medicare who call us also have Medi-Cal. So we can also answer questions about how Medicare works with Medi-Cal. Or if you have questions about how Medicare works with employer insurance or with retiree health benefits, we're able to answer those kinds of questions too. So if you ever find yourself in a situation where you're not sure how Medicare works, what your Medicare benefits are, or what type of coverage options you have, please give us a call for some free counseling and advice. We do not sell insurance. We do not represent or recommend any particular insurance plans. So, our goal is just to make sure that you understand how your benefits work. We're not here to sell you anything or to change your existing coverage. Most of our funding comes from the California Department of Aging Health Insurance Counseling and Advocacy Program. The abbreviation for that is HICAP, H-I-C-A-P. And so the reason I mention that is because Center for Healthcare Rights is also known as HICAP. So we serve all of LA County. If any of you happen to be in Orange County or in another county in California, you'll have to contact your local HICAP office. And I can give you those phone numbers at the end. But if you live in Los Angeles County, the important phone number to remember for our office is 1-800-824-0780. So again, that's 1-800-824-0780. So as I said a few minutes ago, the purpose of today's presentation is to discuss preventive services and vaccines, right? So we're going to start with a little overview of Medicare Part B. Then we're going to talk about the preventive benefits. We're going to talk about the differences between preventive and diagnostic visits, and you'll see why that's very important. We're going to talk a little bit about coverage of vaccines as well at the end. So remember that Medicare has 3 different parts. Part A, hospital insurance. Part B, as in boy, medical insurance. And Part D, prescription drug coverage. So Part B is what we're going to focus on mostly today. Part B, medical insurance, covers a lot of different services. On the day-to-day, most people are using Part B primarily because Part B is what covers doctors, specialists, labs, outpatient therapy, medical equipment and supplies. So for example, if you use a blood glucose meter to check your blood sugar levels, if you have a wheelchair, if you use a cane or a walker, those types of medical equipment and supplies are also covered under Part B. And then I can't remember if I mentioned labs, but labs, x-rays, and other diagnostic exams are also covered under Part B. And so again, today's topic is preventive services. And so the key takeaway here is that preventive services are covered under Medicare Part B, as in boy. Now, Medicare recently released information about what the costs for Medicare are going to be next year in 2022. So for next year, the monthly Medicare Part B premium is going up pretty drastically. It was $148.50 this year, and next year it'll be $170.10. So that's a pretty significant jump. And remember, Part B is typically deducted from your Social Security retirement check on a monthly basis. So that's how most people pay for their Medicare Part B coverage. Aside from a monthly premium, if you are on original or traditional Medicare, there's also a Part B annual deductible. This year it was $203. It's going up. Next year it's going to be $233. So remember, the deductible is the amount you have to pay for your services before Medicare will start paying for those services. So there is that yearly deductible that you have to meet at the beginning of the year. And then once you pay your deductible for Part B, then Medicare covers 80% of the approved charges for your Part B services. And you, the patient, have to pay the other 20%. That is called a co-insurance. Some people call it a copay as well. But when it's a percentage, so in this case, 20%, we call it a co-insurance. Now, as you may already know, your costs, what you actually pay for your Medicare services, might vary depending on what your coverage actually is. So for example, the costs that I just shared with you are for people who are on original Medicare, straight Medicare, also called traditional Medicare, right? If you decide to join a Medicare Advantage plan, which in many cases is an HMO plan, then your costs are going to be different than the ones I just mentioned, right? Because each Medicare Advantage plan sets its own costs for their members. So what else can affect what you pay for your Medicare services? Well, it depends on whether you have any other additional coverage besides Medicare. So for example, if you have straight Medicare, but you also have a Medigap, a private Medicare supplement, right? Then your Medigap is going to help you pay for your copays and deductibles. Or if you are low income and you qualify for Medi-Cal insurance through the state of California, then Medi-Cal is going to pick up your copays and deductibles and your Part B premium, which I mentioned is going to be $170.10 next year. And then, of course, you know, for people who may have some type of employer coverage or a retiree health plan through a former employer, that can affect costs as well. So that's just an important reminder that, you know, everyone's situation is a little bit different. So when we're talking about costs for Medicare services, we really need to see, okay, well, what is your coverage? You know, are you on original Medicare with Medi-Cal? Do you have a supplement, or are you in a Medicare Advantage plan? Okay. So for the preventive services we're going to talk about today, most of these services don't have any out-of-pocket cost as long as the doctor accepts what's called Medicare assignment. When the doctor accepts Medicare assignment, basically that means that they're agreeing to accept the Medicare approved rate. So again, for most of the preventive services we're going to talk about today, there is no out-of-pocket cost, no copay or deductible. So what is preventive care? Basically, preventive care includes any services that are used to evaluate your health, prevent illness, detect medical conditions, and the goal is to help people stay healthy. So preventive services can include not just screenings, but also vaccines and different types of counseling. The last time I checked, I think there's about 30 different preventive benefits that are covered under Medicare Part B. And so we're going to look at a few different charts. And I'm only going to point out a few preventive benefits because we would be here all day if we wanted to talk about all 30 different benefits. So on this slide, we have a chart with all the preventive services that are available to everyone who has Medicare Part B. So in other words, anyone with Part B can ask for these preventive benefits. There are no additional requirements that have to be met, okay? The annual wellness visit and the welcome to Medicare exam are highlighted in purple because those are two really important benefits that a lot of people don't really take advantage of. And so I'm going to give you more information a little bit later in the presentation about how the Welcome to Medicare exam works and how the annual wellness visit works. Let me just point out briefly, for example, the cardiovascular preventive benefits, because I know a lot of people have concerns about their cardiovascular health. So under Part B, you can get a cardiovascular disease screening once every 5 years for no copay. And this is going to include blood tests for cholesterol, lipid, and triglyceride levels. And so the goal of this screening is to help detect conditions that may lead to heart attack or stroke. right? Aside from those screening blood tests, Medicare Part B also covers cardiovascular behavioral therapy, which pays for your doctor to discuss the use of aspirin, if it's appropriate, if they recommend aspirin, right? Also to discuss, checking your blood pressure and how to do that, and then giving you tips on eating well. So this cardiovascular behavioral therapy is one of the examples of preventive benefits that fall under that kind of counseling category, right? It's not really an exam. It's not a vaccine. It's more like a counseling session. And you can get that once a year, again, for no copay. So, especially if you're someone who maybe has a family history of heart attack or stroke, or, you've had issues or concerns with that, that might be something to talk to your doctor about, is making sure you're getting your cardiovascular disease screening once every 5 years. The other big one that I want to mention on this slide is the prostate cancer screening. Because I know there is, a lot of talk about prostate cancer among older adults. So Medicare does cover prostate cancer screening for men age 50 and over once a year. And if you'll notice, the copay or the cost can be anywhere from 0 to 20%. This is the only benefit on this slide that may have a copay. All the other ones have no copay, right? So the alcohol misuse screening, no copay. The cardiovascular therapy and screening that we talked about has no copay. The depression screening, the mammogram, the cervical cancer screenings, those all have no copay. So for the prostate cancer screening, the reason why there may be a copay is because there are actually 2 types of screening tools. There's a PSA test, prostate specific antigen test, that has no copay. And then there's the digital rectal exam that has a 20% copay or coinsurance. On this next slide, we're going to start talking about the preventive benefits that are not available to just anyone. Okay, so it doesn't matter if you have Medicare Part B, that's not enough to get these other preventive benefits. These other preventive benefits we're going to talk about now require you to meet specific criteria in order to be covered by Medicare. So, for example, the colorectal cancer screening. Colorectal cancer screenings are only available for people who have specific risk factors. And colorectal cancer screening can actually be quite complicated. The coverage can be quite complicated because if you'll notice, the frequency can vary and the costs can vary. The reason is that there's different types of screening tools available. And you can only qualify for certain types of colorectal cancer screening services depending on, your risk factors. So if you have questions about colorectal cancer screenings, you can call us for more details. Again, it's just too complicated to talk about in today's presentation. But please know that that is a covered benefit under Medicare Part B. And then one thing I do want to point out on this slide is that Medicare does cover several types of different cervical cancer screening for women, right? So the cervical cancer screening with an HPV test, human papillomavirus test, is covered every 5 years at no copay. And then on the previous slide, we have a cervical cancer screening with a pap smear and a pelvic exam. That's covered once every 2 years for no copay. So the pelvic exam and the pap smear is available to all women with Medicare Part B. There is no additional medical requirement that has to be met. So if you're a woman and you have Medicare Part B, please make sure you're getting your cervical cancer screenings. And again, that will include a pap smear and pelvic exam once every 2 years, no copay. The cervical cancer screening with HPV test is only available for women age 30 to 65. So if you're already over 65, you can't get the HPV test, but you can still get your pap smear and pelvic exam. On this slide, we have several more preventive benefits that, again, require you to meet special or very specific medical criteria. On this slide, I want to point out that Medicare has several preventive services relating to diabetes. So unfortunately, diabetes is a very large concern here in the US, right? And so Medicare has diabetes screenings available, diabetes self-management training, and there's also the diabetes prevention program, okay? So the diabetes screenings include glucose lab tests, if your doctor determines that you're at risk for developing diabetes, and you can be eligible for up to 2 screenings every year. And so in order to be eligible for those glucose test screenings, laboratory test screenings, you have to have any of these following risk factors. So high blood pressure, a history of abnormal cholesterol or triglyceride levels, obesity, or a previous history of high blood sugar. So again, for diabetes screenings, you can't get them, not just everybody can get them. You have to have a specific risk factor. All right, so on this next slide, actually, let me go back to the diabetes preventive benefits again. So there's the self-management training program and the diabetes prevention program. So the diabetes prevention program is basically covers weekly sessions in a group setting over a 6-month period. And those sessions are supposed to help people, make lasting changes to their diet, exercise, get tips on controlling their weight. And it's a group setting. So the idea is that you are with other people who are also in your situation, and you're able to support each other to meet your goals around exercise, controlling weight, and making changes to diet, right? So the prevention program starts with those weekly sessions over that 6-month period. And then after that, you get 6 monthly sessions, so once a month, right? And if you meet certain weight loss goals and attendance goals for the program, it can extend for another 12 months. So again, if you or someone is dealing with diabetes, let them know that Medicare covers these group sessions where people can go and get support and be with other people who are, trying to make those same changes with their diet, exercise, and controlling their weight. right? Because it's really hard to make changes when you're on your own. All right, on this slide, I want to mention that Medicare also covers several screenings for sexually transmitted infections and HIV. Unfortunately, a lot of people don't talk about, like to talk about sexually transmitted infections, especially among older adults. But you know, it is an issue. And so Medicare Part B covers screenings for that. And just to give you an idea of how specific some of these requirements for the preventive benefits, certain preventive benefits can be, I wanted to point out hepatitis C screenings. So hepatitis C screenings are covered by Medicare if you meet one or more of these conditions. You're at high risk because you have used illicit injection drugs, you had a blood transfusion before 1992, or you were born between 1945 and 1965. So if you meet any of those conditions, Medicare would cover a hepatitis C screening. But again, they're very, very specific requirements, right? Like, so for example, you had to have had a blood transfusion before 1992, not 1993, not 1994, 1992. So again, if you have any questions about some of the details relating to the preventive benefits, please give us a call so that we can look up the requirements for you. And you can always talk to your doctor as well. You know, your doctor is the one who is the most familiar with your medical history. So they can, you know, they are the best person to recommend you for these different screenings and exams. And then one more relating, kind of relating to diabetes that I want to mention is glaucoma. So Medicare Part B does cover a glaucoma screening once a year. And this can have a cost of 20%. So there is a 20% coinsurance. And the Part B deductible also applies. So if you haven't met your deductible already for the year, you would have to pay your deductible during that visit. So who can get a glaucoma screening? It's not available just to anybody, because remember, we're talking now about benefits that require you to meet specific requirements in order for Medicare to cover them. So glaucoma screening is available for people who are considered at high risk for glaucoma. That includes people who have diabetes, people who have a family history of glaucoma, African Americans age 50 and older, or Hispanic Americans age 65 and older. So again, if you have diabetes, you would be eligible to receive a glaucoma screening once a year, because remember, diabetes does affect your eyes and your vision. So if you have a history of diabetes, please, 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 you know that you can get a glaucoma screening. All right, so next I want to talk about mammograms specifically. Mammograms are a covered preventive benefit for women. And so here I have an example of someone named Rosa, who is 66 years old, and she had a screening mammogram last week. The results from her mammogram indicate that everything is normal and she doesn't need any follow-up. So the question is, does Rosa have to pay anything for her mammogram? And the answer is no. Screening mammograms, which fall under the preventive benefit, have no copay. So why am I mentioning this? Again, if you are a woman on Medicare, you can get your screening mammograms to check whether there's any concern for breast cancer. Here we have an example of Annie, a different case. She has a history of breast cancer, but she's been cancer-free for over 10 years. She recently started Medicare, and she has a mammogram scheduled for March. So the question is Annie gonna have any copay for her mammogram? And unfortunately, the answer for her is yes. She is going to have a copay or a coinsurance of 20%. And the reason is that because Annie has a history of breast cancer, her mammogram is considered diagnostic, not preventive. So remember, in the previous slide, Rosa's mammogram came back normal, and she doesn't have a history of breast cancer, so hers was a screening mammogram. But Annie's, because she has a history of breast cancer, even though she's cancer-free now, her mammogram is not considered a screening mammogram. Hers is considered a diagnostic mammogram. So diagnostic services are different from preventive services. Diagnostic services are used to investigate or treat a health issue. So it can include treatment for specific symptoms, risk factors, or ongoing care. And it can include labs or other tests needed to manage or treat a medical issue or health condition. So a preventive visit may turn into a diagnostic visit if you bring up a health concern during your service, or if your doctor discovers a health issue during your screening service. So I next want to look at the issue of colonoscopies. So we have this patient named Stanley who had a colonoscopy a few years ago, and everything went well. But he recently had another colonoscopy, and this time the doctor found a polyp and removed it during the colonoscopy. So Stanley is surprised when he receives a bill. He didn't have to pay for his first colonoscopy. Why is he getting a bill for this colonoscopy? And so the reason is that, you know, when Stanley went in for this second colonoscopy, you know, it was scheduled as a screening visit, right? Because he doesn't have a history of any colon cancer or other issues, right? So it was scheduled as a screening colonoscopy. But again, during the procedure, when the doctor found the polyp and removed it, it became a diagnostic service. So the point is that you may go in thinking that your service is going to be a screening service, but if something comes up during the test or the exam, and your doctor has to provide some type of follow-up or treatment, then it's going to become a diagnostic service. So it's going to change how Medicare covers and pays for the visit. And so it may change what you pay for the service. Just so you know, Medicare is proposing to change how this works for colorectal cancer screening specifically. And so the idea is that if during a colorectal cancer screening, if it turns out that the screening becomes a diagnostic visit because the doctor finds an issue, for example, in the case of Stanley, the doctor found the polyps and the doctor had to remove the polyp, right? The proposed rule change is that patients won't have to pay a copay even when that service switches from a screening service to a diagnostic service. Medicare also covers diagnostic lab tests. So lab tests can include blood exams, urine exams, exams on tissue specimens, right? And these diagnostic tests can be ordered by your doctor in order to help manage or rule out specific illnesses or health conditions. So Medicare also does cover diagnostic tests, right? But your doctor has to order the tests and they have to be medically necessary. And the cost can really vary. So now I want to switch to the Medicare, the Welcome to Medicare visit. So if you remember at the beginning, I mentioned that we were going to talk a little bit more about the Welcome to Medicare exam and the annual wellness visit in more detail, because unfortunately, a lot of people aren't using the Welcome to Medicare exam or the annual wellness visit, and they are two very important preventive benefits that Medicare covers. So the Welcome to Medicare exam is one of those exams that anybody can use. You don't have to meet any specific medical requirements. As long as you are new to Medicare and you are in your first 12 months with Medicare Part B, you can ask your doctor for your Welcome to Medicare exam. And you can only get it once during that first 12-month period. And the Welcome to Medicare exam is pretty comprehensive. The goal is to promote your health and prevent and detect diseases. So the doctor will start usually with reviewing your patient medical and social history. So they're going to ask you about your past medical and surgical procedures. What illnesses have you had? What hospital stays have you had? Have you had any operations, any injuries? What treatments have you undergone? Then they're going to ask about what current medications you're taking. They're going to ask you about your family history, right? They're going to ask you about, what is your diet like? Are you physically active? What kind of physical activity do you do? Do you use alcohol, tobacco, or illicit drugs, right? They're also going to talk with you about whether you have any current or past experiences with depression or other mood disorders. They're also going to look at your functional ability and how well you are able to do your activities of daily living. How well are you able to bathe on your own? Are you able to use the toilet on your own? Are you able to prepare meals for yourself? Are you at risk for falls? And there is a bit of an exam that's going to involve physical touch, in which the doctor will take your height, your weight, your blood pressure measurements, right? But again, this exam is not a physical exam. This Welcome to Medicare exam is more about reviewing your larger situation, right? And one important piece of the Welcome to Medicare exam is that your doctor can also talk to you about end of life planning. A lot of people don't like to talk about what's going to happen to them or what their wishes are if they were to fall ill or if they were to no longer be able to speak for themselves and make their own decisions, right? But it's important to talk to someone about what your wishes are. And that can come under this discussion of end of life planning, where you talk about, you know, what does it mean to prepare an advance directive in case you become injured or ill and you can't make your healthcare decisions on your own anymore, right? So the end of life planning can be an important part of that Welcome to Medicare exam. And again, because this visit is looking at your overall situation, your medical history, your current medical and physical situation, your doctor can then use the information from this visit to refer you for your preventive services, right? So you're supposed to come away from this visit with a plan or a checklist for you to go for your other preventive services that we've been discussing today, right? So, hey, did you already do your mammogram? Oh, hey, I see you have a history of diabetes. Have you gotten your glaucoma screening? Or hey, it seems like you've have issues with cholesterol. Let's do, your cardiovascular disease screening. So the Welcome to Medicare exam can only be done once within that first 12-month period, basically within the first year that you have Medicare Part B. And the way to ask for it is, call your doctor's office and let them know, hey, I'd like to schedule my Welcome to Medicare preventive visit. And there is no copay for the visit itself, right? Now, if the doctor sends you for other tests or services that are not preventive services, there may be a deductible or a copayment. The second type of exam that I wanted to spend some time reviewing is the annual wellness visit. The annual wellness visit can be done once a year. So again, the Welcome to Medicare exam is within that first year that you have Medicare Part B. The annual wellness visit is once a year after that. And there's no out-of-pocket cost for the annual wellness visit itself. Again, if your doctor sends you for additional tests or services, those may have a cost, but the annual wellness visit does not have a copay. And again, the annual wellness visit is a follow-up from the Welcome to Medicare exam, where the doctor can review your health risk assessment and help you develop your personalized prevention plan and make sure that you're keeping up with all your screenings and all your preventive benefits. So one of the questions we get a lot has to do with, is the annual wellness visit the same as a physical, right? So here we have a patient named Raul, and he hasn't really used his Medicare benefits. He's had Medicare for 2 years. He wants to go for a checkup with the doctor. And he's heard of the annual wellness visit, but he's wondering if it's the same as the physical. And the answer is no. The physical is not the same as the annual wellness visit. And in fact, one key piece of information for you all to know is that Medicare does not pay for physical exams. Okay. Medicare does not pay for physicals. So if you get a physical, you're going to have to pay 100% of the cost. Okay. What Medicare does cover is the annual wellness visit. And the annual wellness visit is more comprehensive than a physical, because in a physical, they're just checking your vital signs, right? Or looking at your physical health. But with the annual wellness visit, the doctor, again, is using those conversations with you to update your personalized plan based on your current health and risk factors. So they're going to ask about the medical history. They're going to look at, whether you have any signs of Alzheimer's or dementia. They're going to ask you about, what current medications you're taking. They're going to ask you about, whether there's been any changes to your medical or family medical history. And again, it's the time to update your personalized plan and to provide you with an updated screening schedule to make sure that you are receiving all your preventive services. So just quickly, I want to talk about some coverage of Medicare vaccines. And so most vaccines, when it comes to Medicare, are covered under Part B, like boy. So hepatitis B, the yearly flu shot, the pneumonia vaccine, and the COVID-19 vaccine are all covered under Medicare Part B, as in boy, and there's no copay for those vaccines. If you were ever to become injured or have a direct exposure to a disease, for example, to tetanus, Medicare Part B also covers those vaccines. There are two important vaccines that are covered under Part D, prescription drug coverage. That's the shingles vaccine and the Tdap vaccine. Okay, so again, shingles and Tdap are covered under Part D. Most other vaccines are covered under Part B, as in boy. So if you do need to get a vaccine that's covered under Part D prescription drug coverage, make sure you and your doctor's office contact your Part D drug plan in advance to make sure that they charge you the correct copayment for the vaccine. The drug plan is not supposed to charge an administration fee for giving the vaccine, but they can charge a copay for the vaccine itself. And again, it's better to contact the drug plan in advance to make sure that the copay they're going to charge you for the vaccine is the correct one. And so if you ever have any questions about the Part D vaccines, which again are shingles and Tdap, please feel free to give us a call and we can guide you more about how to go about actually getting that vaccine and making sure that they're charging you the correct copayment. All right. So again, because right now COVID-19 is on everybody's mind, please remember that Medicare Part B as in boy covers the COVID-19 vaccine at no cost to you. If anybody calls you or visits your house or is trying to get information from you about your Medicare number, your Social Security number, or they're trying to charge you for the COVID-19 vaccine, please know that that is a scam, okay? Neither Social Security nor Medicare call people to ask for personal information or for payment. So please, please, please be very careful about any COVID-19 vaccine scams. The Center for Healthcare Rights is currently working with the California Senior Medicare Patrol to help educate people on issues of Medicare fraud. You know, we want to make sure that everyone is empowered and knows how their Medicare benefits work. We want to make sure that you don't become victim to any scams having to do with Medicare. And again, unfortunately, COVID-19 vaccines are an ongoing, COVID-19 vaccine scams are an ongoing problem. So if you encounter, you know, any kind of scam, please feel free to reach out to us. Or you can contact the Senior Medicare Patrol as well. And speaking about COVID-19, I do want to just point out briefly some of the other services that Medicare covers relating to COVID-19. So Medicare does cover the diagnostic test for COVID-19. So for example, if you are worried that you may have been exposed to COVID, you can get a diagnostic test at a lab, pharmacy, doctor, hospital. Medicare covers the test at no copay. Medicare also covers what's called the antibody test for people who have been infected with COVID-19. There is an exam that looks to see, you know, whether you have any antibodies, and that is also covered by Medicare at no copay to you. The vaccine and the booster are covered by Medicare at no copay to you. If you have to be hospitalized due to COVID-19, obviously Medicare Part A does cover inpatient hospital stays. If you have to have an extended stay due to quarantine, Medicare will also cover that. But unfortunately, please know that Part A hospital services do have a deductible, right? So a deductible may apply for your hospitalization. And then Medicare also covers the monoclonal antibody treatment for people who are sick with COVID. And then just to wrap up and connect it all back to the topic of today, which was preventive services, please know that, you know, due to the COVID-19 pandemic, Medicare does now cover telehealth for some visits, including for some preventive services. So for example, the cardiovascular behavioral therapy and some of the other more counseling type preventive services can be covered through telehealth, meaning you don't have to go in person. You can go online and connect virtually to your doctor's office to receive telehealth. If you ever have any questions about the coverage for preventive services, whether you meet the guidelines, or if you have questions about submitting an appeal if you receive a notice saying that Medicare denied the service, you can always call us for more assistance with that. But I just want to point out that there is something called Advance Beneficiary Notice of Non-Coverage, also known as ABN. This is a form that a doctor or a lab or any other provider can sometimes give you if they think that you're going to be receiving a service that Medicare may not cover. So it's basically notifying you, hey, Medicare may not cover this. And you have to decide whether to proceed. Are you going to go ahead and receive the service knowing that Medicare may not cover it? Or are you going to say, no, if you think Medicare is not going to cover it, then I won't get the service, right? So the point is, if you are given an advance beneficiary notice of non-coverage, please read it carefully and then decide whether to sign it and proceed or not. But never sign an ABN after a service has been provided. Okay, so if the provider already gave you the service, they can't ask you to sign an ABN afterwards. Okay, so again, for any questions about billing or coverage, please call Center for Healthcare Rights. Our phone number again is 1-800-824-0780. And so just the last thought that I want to leave you with is, because of the pandemic, a lot of people have delayed or canceled a lot of their medical services, right? Either by choice or because the provider canceled the appointments, right? And so we just want everyone to know and to not forget, Medicare covers some very important preventive services. Make sure you are taking advantage of those benefits so that you can stay healthy, detect any illnesses that may come up. And again, these are your benefits. Make sure you use them. And if you have any questions about any of the cancer screenings, lab tests, or the counseling or therapy sessions, please feel free to reach out to us. Thank you, everybody.
Thank you so much, Catherine. There was a request for seeing the slide number 29 again, if you can scroll back to that one. Thank you. And Oliver's, we have kind of run out of time. Is there anybody in the room who has a very important short question that maybe Catherine can answer? We have to respect her time as well. Is there anything that you would like to ask her? This is the time. Most of you are muted, so you might have to unmute yourself. We'll take one question.
Yeah. Can I say something?
Yes, please go ahead.
Yeah, I want to know the age for pap smear, mammogram, bone density, or till what age are we supposed to, have these tests done?
Yeah, that's a good question. So for the mammogram, there's two different, it's split up in two, right? So if you're a woman between 35 and 39, you can get one mammogram during that period between 35 and 39. Once you're 40 and older, you can get it once a year. And then for the cervical cancer screening, it's once every 2 years, regardless of what your age is. And that includes the pap smear and the pelvic exam. The only difference was for the cervical cancer screening that includes the HPV test. That's only for women, if I remember correctly, that's only for women between 30 and 65, but let me double check. Yeah, the HPV, human papillomavirus test, is only for women 30 to 65, but the pap smear and pelvic exam is once every 2 years, regardless of what your age is.
My doctor just told me that you are 70 above, so there is no need for a pap smear. There's no need for a mammogram. You're free to go. I was like confused at that time.
Yeah, I'm not a medical professional, so I don't know if they look at other kind of criteria for determining that. I mean, but Medicare does cover it as a preventive visit. I mean, I think one thing is whether your doctor thinks there's a need versus, hey, is this a benefit that you have access to through Medicare? And I don't know, I would push back on that idea that there's no need for it, like what is the doctor basing that on?
She recently told me, you're free. Now no need for a mammogram and for a pap smear.
Well, I don't know, because I'm not a medical professional, but I thought, it doesn't matter what your age is. There's still, a concern that you could develop breast cancer. But again, I'm not a medical professional.
All
Okay,
right.
let me ask her this question again when I meet her the next time.
Yes, thank you for always advocating for your health. Thank you, Catherine, again for your time. If you have any other questions, please go ahead and email them to me, and I will ask or forward them to Catherine, or you can simply call the Center of Healthcare Rights, as she's mentioned the number several times. So again, thank you, Bilal and our Sahara friends, for bringing us this session. We really are appreciative of this collaboration.
Olive Community Services is a 501c3 nonprofit organization based in Southern California that provides culturally appropriate services to seniors, their family, and the community. Through its physical and virtual interactive programs, Olive engages participants in a variety of ways that promotes health and well-being. To learn more about Olive Community Services, to get involved, or to make a donation, please visit www.olivecs.org or email info@olivecs.org. Be a change maker, and together, let's live, learn, and thrive.